So here's a patient again. Most of the patients are pseudophakic with the category. A lot of these have multifocal lenses, extended depth of focus lenses. I'm very comfortable using the symphony lens or the panoptic lens in patients with good visual fields, healthy nerves. Here it is not at an acute angle, but I try to stay below the pupil. And you can see again, sometimes it'll migrate towards the incision site. So here's a pseudophakic patient with an extended depth of focus implant. Most of these patients have had MIGS procedures as well, and the point is to try to get them off as many drops as possible. This is not a real acute angle, it's a more parallel. I like maybe to do a little more acute angle if I can, but you can, whatever gets you into the eye comfortably is worth doing. Here you see another pseudophakic patient for the Durista. Sometimes she was a little bit more nervous than some, and I did a little counter pressure on her with my finger, and I had a nice acute angle. And one thing you learn with this injector is if you have your finger a little bit more posterior on the injector, it will often come out faster and a little bit more smoothly. You can't always predict it, but you can see that this came out very quickly. So here we have something I think any ophthalmologist is going to inject the bimatoprost. I prefer to use a wide open, not the slit beam, because I get to follow the patient a little bit better. Often they will move around a little bit. Sometimes they're a little bit nervous. The whole point is to talk to them very slowly, carefully, and prep them for this. You can see often sometimes it's a little hard for the upper lid to stay open, so you saw someone hold the lid, but there is about 2 bevels in, click, and you don't even see that thing. That baby shot right out. You can see it sitting at 6 o'clock very carefully. I try to now do the slit beam to show where the bimatoprost stent is, and the product is deep into the angle. These are pseudophakic patients. Most of the patients right now are of the Medicare age group. Most of them are pseudophakic that I've done. I've done a fair number of phakics as well, but it's been because of insurance. They're mostly Medicare with secondary insurance. Some of the other insurances have started to accept the prior authorizations. So this is a demonstration of injection of the Durista or bimatoprost implant for glaucoma. The physician usually will need someone else to help them hold the upper lid for the patient. I often and almost always do a counter pressure, sometimes with a Q-tip, which I soak in a couple drops of proparacaine, or my finger. I think if I can use a finger on someone with a lax lid, it stabilizes the eye. Often the injector will slowly release the implant. Sometimes their air bubbles will shoot the implant straight up to 12 o'clock. It's rare, but it happens. It will eventually find its home in a very short period of time. If it is stuck to the injector, I will roll it around a little bit, and I will show you some other videos. After this, it's painless. Takes about 12 seconds. Patients are surprised, happy, and thankful.